Hi everyone, I am Dr. Shobna, Assistant Professor, Department of Pharmacy Practice from Sri Shanmugha College of Pharmacy. In this video, we are going to discuss about medication error. What is meant by medication error? Medication error is an event associated with the use of medicine that should be preventable through effective control system. That means when we use the medicine, there may be a cause of error. It can be prevented through the control system. The American Society of Health System Pharmacists, that is ASHP, definition of medication error includes prescribing, dispensing, medication administration, and patient compliance error. Next, the types of medication error through drug administration error, prescribing error, or through the dispensing error. Types of medication error as per ASHP, that is prescribing error, omission error, wrong time errors, unauthorized drug errors, improper dose errors, wrong dosage form errors, wrong drug preparation errors, wrong administration or technique use error, deteriorations error, monitoring errors, and compliance errors. In this compliance errors occurs to only from the patient. Remaining all those things error occurs due to the physician, that means doctor, or a pharmacist, or by a nurses. Next, we can see one by one about the types of errors. First one, prescribing error, that is incorrect drug selection, dose, dosage form, quantity, route or concentration, rate of administration or instruction by the physician. That is incorrect drug selection. If I have a fever but the doctor has given an aceclofenac instead of paracetamol, this is the incorrect drug selection. And dose, there is a only 500 mg or a 650 mg, but the doctor prescribes 600. It is a wrong. And dosage form, instead of tablet, he prescribes a capsule. And quantity, instead of 2 tablet, the pharmacist dispense instead 3 or 4 more than like this. Next, omission error, failure to administer the prescribed drug or a dose to a patient. This may be occurred due to the nurses or from the patient when failure to administer the prescribed drug. If the patient need to take the drug at the morning 8 p.m. but the nurses forgot to administer that, it may be a occurs due to omission error. And wrong time error. If your drug need to be administered at 6 p.m., it should be administered at the 6 p.m. Insist they are administered at the 7 or 7:30, it is the wrong time error, deviation from the prescribing drug of an ordered drug. Next, improper dose selection. Administrator of dose that is greater. Instead of, if example, paracetamol is 650 mg, but the doctor or nurses or a pharmacist given at more than a double dose, it is an overdose. Or instead of 650 mg, he given only 500 mg, it is a low dose, that is subtherapeutic rather than the amount they prescribed. Then wrong dosage form error, administration of drug product in a different dosage forms. We have a dosage forms like tablet, capsule, syrup, suspension, emulsion, ointment, and patches, etc. If the paracetamol syrup we have to given for your children, but the wrong dosage from capsule will be returned. Next, wrong drug prescription error. The drug product incorrectly formulated or manipulated before the admission. When preparing the drugs, there may be a error. Next type is deterioration drug error. Administration of a drug that has been expired. The expired drugs has been prescribed or a dispensed. That is deterioration drug errors. Next, monitoring errors. Failure to review a prescribed regimen for an appropriate needs or failure to assess the response to their prescribed therapy. When a doctor fills a prescription for an inpatient for daily. So he stopped the medications, but the nurses incorrectly or forgot to give the medications. Next, compliance error, failure of the patient to adherence to the prescribed medications. That the pharmacist or a physician already prescribed a medicine, but the patient has been not adherence to the prescribed medication, not obeyed to take the medications. Other medication errors, any other than that falls on into the above categories are known as the other medication error. Next, the prevention of medication error. Review flow stock to exclude expired drugs. Use of proper labeling of drugs. Look like and sound like drugs should be sold separately. Perform double check while prescribing, dispensing, and administration of the drugs. Develop strategies, that is, use capital letters while prescribing a drug. Abbreviation should not be used. Specify exact doses of the drug. Avoid ranges dose. Standardize the prescription order and in computerized prescription. Next, five right things: right patient, right drug, right dose, right route, and right time should be confirmed before the administering the drug to the patient, and patient should be educated about these errors.